What happens when you stop taking Risperdal Consta? Have you ever wondered what really happens when someone stops taking Risperdal Consta? This long-acting injectable antipsychotic is commonly used to treat schizophrenia. It helps manage both positive symptoms, like hallucinations and delusions, and negative symptoms, such as emotional withdrawal and lack of motivation. But what occurs when a person decides to stop this medication? First, one of the most significant risks is the relapse of schizophrenia symptoms. Research indicates that about 78.8% of patients experience a relapse after discontinuing Risperdal Consta. The median time to relapse is roughly 163 days, which is about 5 to 6 months after the last injection. This means that symptoms can return or worsen, and the severity of the relapse can be unpredictable. Next, it's important to note that Risperdal Consta is a long-acting injectable. This means that the active drug remains in the bloodstream for about 6 weeks after the last injection. During this time, the medication still has effects, but as the levels drop, the risk of symptoms returning increases. Additionally, stopping Risperdal Consta may lead to withdrawal symptoms. These can include rebound psychosis, which is a sudden return of psychotic symptoms that can be more intense than before. Other withdrawal effects may include hallucinations, nausea, vomiting, and anxiety. These symptoms can complicate the process of stopping the medication and may require careful management. Another consideration is Tardive dyskinesia, which is a movement disorder that can occur with long-term use of antipsychotics like Risperdal Consta. While stopping the medication may lead to some improvement in symptoms, there is also a risk that symptoms can persist or even appear after discontinuation. This highlights the need for careful evaluation before making the decision to stop treatment. When discontinuing Risperdal Consta, it is often recommended to taper off the medication gradually rather than stopping abruptly. For example, if a person is taking doses above 25 milligrams, they may taper down to 25 milligrams every 2 weeks before stopping completely. This gradual approach helps reduce the risk of sudden relapse and withdrawal symptoms. Lastly, it is essential to make this decision under medical supervision. Schizophrenia is a chronic condition that typically requires ongoing treatment. The decision to stop should consider the benefits of symptom control against potential side effects. Regular reassessment of the need for continued treatment is vital to minimize risks and support the best outcomes. In summary, stopping Risperdal Consta can lead to a high risk of relapse within several months. The medication continues to work for about 6 weeks after the last dose, but withdrawal symptoms and movement disorders may arise. Gradual tapering under medical guidance is the best way to manage the process and maintain stability in treating schizophrenia.